Your Excellency, Mr. Francis Hollande, President of France, Your Excellency, Mr. Jacob Zuma, President of South Africa, Dr. Margaret Chan, that's me, and Dr. Anglo. Mr. Angel Curry, Secretary General of the OECD, Mr. Guy Ryder, Director General of the ILO, Excellencies, ladies and gentlemen, friends, I am pleased to be able to join you today. In March, I appointed the High-Level Commission on Health, Employment and Economic Growth after the General Assembly requested that I, in quotations, explore steps to meet the global shortfall of trained health workers. I am very grateful to President Hollande of France and President Jacob Zuma of South Africa for their leadership in co-chairing and to members of the Commission for their hard work. The work of this Commission is very relevant to the success of the 2030 Sustainable Development Agenda and the promise to leave no one behind. The global population is not only expanding, but aging as living standards rise. The downside to this is that non-communicable diseases such as diabetes and cancer are affecting ever more people. By 2030, it is estimated that demand for health services will create 40 million jobs globally. But most of these jobs will be created in the wealthiest countries. And despite the creation of more jobs, it is estimated that there could be a shortfall of 18 million healthcare workers globally. This will be felt most acutely in developing countries. We can and must avoid this scenario. The answer is appropriate public sector policies. The report of the High-Level Commission on Health, Employment and Economic Growth points the way to a world where all countries have the health workers they need, in the right numbers, with the right skills, and in the right places. By following this roadmap, we can progress towards universal health coverage, create millions of jobs, and drive inclusive economic growth, especially for women and young people. The health sector is an economic powerhouse. Between year 2000 to 2011, almost 1/4 of economic growth in low and middle income countries came from improvements in healthcare. In OECD countries, more than 10% of all jobs are in the health and social sectors. Between year 2000 and 2014, these sectors experienced 48% employment growth, even when jobs in industry and agriculture were in decline. Investment in health systems pay handsome dividends for public health, economic growth, gender equality, and human security. Health workers are a boost to productivity, and they help individuals, families, and communities to flourish. Jobs for healthcare workers are also jobs for women. Women account for 67% of jobs in the health and social sectors, compared with 41% of total employment. And in a world where many countries face record levels of youth unemployment, jobs in health can offer a reliable, meaningful, and well-paid career. The Ebola epidemic taught us that one country's outbreak can very quickly become a global threat. The collapse of health systems in Ebola-affected countries and the severe economic consequences that ensure must serve as a warning to all countries that investments in health systems, including healthcare workers, of course, is a necessity. It is not a luxury. Countries that fail to invest in health are not only jeopardizing the health of their populations, they are missing out on a vibrant source of jobs and inclusive economic growth. The countries that implement the recommendations in this report stand to reap rich benefits. I commend the Commission for its work, and I look forward to transmitting the report to the General Assembly. But no country needs to wait to take action. Starting now, we all need to take decisive steps to turn these recommendations into reality and to harness the economic power of healthcare workers. Thank you.
Thank you very much.